this test tube is representing something like a blood draw. You would take a test tube, you could put it in the centrifuge. That's a machine where you put all these test tubes in, it spins around, spins super fast, and the blood will actually separate based on densities. And you see this in pretty much every physiology book you see, right? So the less dense things will go to the top, the most dense things will go to the bottom, and we'll separate these components out. So you got to remember, blood is a connective tissue. It's a liquid connective tissue, but it's still a connective tissue. So the plasma is going to be the liquid portion of the blood. It's mostly water and protein. Then all these things down here, the cells we call the formed elements, those are going to be the cellular matrix, right? If, considering this a connective tissue, which isn't really clinically relevant, but there you go. So what is in all this stuff? Well, the plasma, the textbook number, this represents about 55% of your blood. The liquid portion, it's mostly water and these proteins. These proteins we call plasma proteins, super important. Of the plasma proteins, the most abundant is this protein called albumin. So albumin, this protein right here, maintains your blood's oncotic pressure. So if you remember capillary dynamics or don't know the hemodynamics yet, osmotic and oncotic pressure are going to pull fluid into the blood vessels at the capillary level. So albumin, these larger proteins like this, are going to pull fluid into the blood vessels. So that's important too, because there's a blood product that you can use called albumin, like 5% or 25% albumin. And when you give this to a patient, it's going to help pull fluid into the blood vessels and maintain their plasma volume. Now, other proteins, globulins, alpha, beta, gamma globulins, alpha and beta globulins, a whole series of proteins and lipoproteins like your HCl and your LDL, and these proteins that carry your hormones around like sex hormone binding globulin, cortisol binding globulin, thyroid binding globulin, C-reactive protein, all these proteins. Then gamma globulins, that's the fancy word for, well, antibodies. Antibodies are proteins. Fibrinogen and clotting factors. So these are proteins circulating in your blood that we'll talk about, that when they become activated, they'll cause blood clotting, right? Whether it's physiological or pathological. And all these proteins are made in your liver, so it's a good thing to note, except gamma globulins. Those are made by B lymphocytes when they differentiate into plasma cells. All those other proteins are made in the liver, and that'll be important later when you talk about patients with cirrhosis and they get hypoalbuminemia, and that can cause edema, and they don't make enough clotting factor, so their blood can't coagulate properly. That'll all make sense later, so it's good to understand these basics. Other than that, a bazillion other things. Electrolytes, your main extracellular ions, so cations, sodium and calcium, anions, chloride, bicarb, and then all the other cations and anions, so potassium, magnesium, sulfate, phosphate, all that stuff. Nutrients like glucose, obviously your blood glucose, right? There's always glucose in your blood. Amino acids, lipids, triglycerides, so on and so forth. And then blood gases, CO2 and O2. So normally this is a damn textbook number, about 7% of CO2 is dissolved in the plasma. About 2% of oxygen is dissolved in the plasma. Obviously, that varies. Most of oxygen is bound to hemoglobin as oxyhemoglobin. 23% of carbon dioxide is bound to hemoglobin as carbaminohemoglobin. And then most of CO2, the other 70%, is buffered, which we'll talk about later. Now, the formed elements, so the blood cells, the buffy coat, less than 1%, this little thin layer on top of the red blood cell mass here, and this contains white blood cells and platelets. There's 5 types of white blood cells. The mnemonic everyone uses for neutrophils, monocytes, lymphocytes, eosinophils, and basophils. And it's also good because that's in most abundant to least abundant. There's about 60% neutrophils, 20 to 40% lymphocytes, 2 to 8% monocytes, like 0 to 4% eosinophils, and like 0 to 2% basophils, something like that. And that mnemonic is, never let monkeys eat bananas, and that's what would go through those, okay? Normal white blood cell count, 4,500, about 11,000 per microliter of blood. So these measurements are per microliter. Platelets, 150,000 to 400,000, again, per microliter. Okay, it's very small compared to red blood cells. If you look at red blood cells, millions per microliters, right? And you see 2 different numbers here for males and females. So males tend to have more red blood cells, and that's because of androgenic hormones like testosterone. Do females have testosterone? Oh, of course. But males have more, so more androgenic hormones, more red blood cells. Okay, so especially we see it with males, you put them on testosterone replacement therapy. Some males will expand their red blood cell volume. I shouldn't say red blood cell volume, the red blood cell mass, and form too many red blood cells and can actually be a problem. They also used to use testosterone and derivatives like anabolic steroids for treating anemia. So keep that in mind. Those drugs will increase red blood cell mass. Okay, so males 4.6 to 6.2 million and females 4.2 to 5.4 million per microliter. So you're talking thousands of white blood cells, hundreds of thousands of platelets, and millions of red blood cells. So this is just to give you perspective. Will memorizing this help you? Depends what you're going into, but just some perspective on it, okay? So this is the components of blood. Now, can these change? These are very textbook numbers, 55 to 45%. So again, what if your patient's dehydrated? You get something called hemoconcentration. This plasma volume, we lose it, gets smaller, right? We're making this restricted. Well, then the percentage of red blood cells would be higher. Do we gain red blood cells? No, okay? But that value we're going to talk about represents something called hematocrit, the percentage of red blood cells to your total volume. And then same thing if our plasma volume expands, right? Well, then that's going to restrict the amount of red blood cell percentage. So it's going to change these numbers, but the number of red blood cells isn't going to change. So things like hematocrit are going to be affected by hydration status, okay? Where red blood cell count itself should not be affected. So that's something to keep in mind. Now, also we talk about blood thinning and thickening. This is a really important topic. It's really confusing. So the consistency of blood is called blood viscosity. So blood viscosity is mostly based on how many red blood cells you have to how much plasma you have. That's going to be literally the consistency. Is it thicker? Is it thinner, right? So when you say I give a patient a blood thinner, you should never say that because you're not really making the consistency of their blood thinner because you're not changing these things. All you're doing is making the blood take longer to coagulate. So you're giving either an anticoagulant like warfarin or heparin, or if you're giving like Plavix or aspirin, you're giving an antiplatelet drug, right? Platelet aggregation forming a platelet plug and the clotting cascades forming blood clotting, that's what causes a blood clot. So if you give drugs like that, it's just making it take longer and less likely to form blood clots, but the consistency of the blood isn't thicker or thinner. That gets a little confusing. So let's say red blood cell mass increases, right? Someone has erythrocytosis, high red blood cell, due to testosterone therapy or due to moving up to a high altitude, or they have COPD, like chronic bronchitis, or sleep apnea. So it's all because they have chronic hypoxemia. That will stimulate the kidneys to make more erythropoietin, tell the red bone marrow to make more red blood cells, right? That would actually make the blood thicker and increase the viscosity. And to some extent that's normal, but you get to a certain point, especially like if hemoglobin's getting closer to like 20 and hematocrit like 60%, that's really high. Then blood has a trouble flowing. That causes blood stasis, and we'll learn about Virchow's triad. Blood stasis is one of the points on Virchow's triad that will cause blood to clot in a non-physiological way, right? A pathological way that we don't want to happen. So again, the blood gets too viscous, it'll cause it to clot more, but that's just because of blood stasis, not necessarily because, oh, my blood is thicker, so it's clotting more, okay? And then the opposite of that, if you have anemia, so real low red blood cells, the viscosity will actually be thinner, right? It doesn't have anything to do with blood clotting necessarily, not directly, but that's going to affect the actual viscosity and consistency of the blood. All right. Now